Okay, we're back. We're live. I'm Jay Fidell, having a wonderful time with my friends here. On the far end, Terry Visperas.
Hi there, Jay.
And he's a public health preparedness coordinator for the Strategic National Stockpile. We're going to find out about it later. Welcome to the show,
Thank
Terry.
you. Pleasure to be here.
Okay, and next to him is Marjorie Tayao. Tayao. And she is a Medical Reserve Coordinator, Medical Reserve Corps Coordinator.
Yes.
Thank you for joining us on the show.
Great to be here.
Yeah, this is one of those shows where we started out a few minutes early and just schmoozed, and the schmoozing got so intense that we were all having so much fun. I'm not sure we want to do the show now. We're all
I thought
done,
it was
yeah?
over. I thought you were taping. I thought we're done here.
Thought it was done.
So why don't we introduce you guys first? Marjorie, why don't you start? How did you get into this? What do you do for the Department of Health?
Okay, so pretty much I'm the volunteer manager for the Medical Reserve Corps, the MRC, and it is kind of a misnomer. So we do take medical volunteers or those with medical or healthcare background, but we also have those who are teachers, students, all walks of life. So we have volunteers from all walks of life, and we take everyone. So I just manage the activities and the training that we do. I'm the state coordinator, so Maui, Kauai, Big Island, as well as Oahu. There are MRC units there, so that's the Medical Reserve Corps. So units on every island, and we just coordinate our activities and exercises with the Department of Health and other agencies.
Okay, zooming back up.
Zooming.
So the Medical Reserve Corps is to do what exactly?
We focus on public health initiatives, so wellness and public preparedness. So being prepared in disasters. So we go out and we educate, we help with the community fairs. You may have been to the Pro Ridge Ready to React. That was just in June. So we have a booth there, and we hand out informational brochures and flyers. So getting the public ready and prepared for natural disasters, man-made disasters, anything with a public health focus.
Okay. And why are you here when you should be preparing for Guillermo?
I'm trying to get the word out to the public.
There it is.
There you
Okay,
go.
all right.
Educate.
Hope you guys are listening. All right. So, what did you study in order to be the coordinator of the Medical Reserve Corps? Do you have a master's degree in Medical Reserve Corps?
Oh no, that's a special degree somewhere else in the world. No, I actually majored in speech communication, so that helps me with the communicating with volunteers. So not Medical Reserve Corps major per se, but close to it. So I would say the most important part of my job is getting the volunteers ready to participate in activities. So in the case of a hurricane, if shelters were to open and we are needed to help support staff, I can communicate with my volunteers, get them mobilized, and have them come down to the shelters to help out.
Okay, we're going to explore your volunteer force in much greater detail in a little while.
Lots of detail.
Let's go to Terry.
Hey,
Terry, how did you get here? How did you get in the door?
This is a long walk, by the way, but it was worth it. So
That's true.
it was
Punch bowl, right?
fantastic. The weather's great outside, by the way, just in case.
Not too hot.
But
anyway.
I'm honored to be here. And again, I just want to thank my team back at the office. They're all tuning in and watching in, and together we make a really great office. And I just wanted to say hello to Dr. Pressler and Dr. Sarah Park for making all of this possible.
Here's to Dr. Pressler. Dr. Pressler.
Really
So-
glad for- Hello.
Yeah.
Yes,
Okay.
I work with you.
So this is
She's the director of health.
She's the director of health, yes.
right. So Dr. Pressler, yes, Director of Health, and Dr. Sarah Park is a state epidemiologist. So together as a team with our office, we're the Public Health Preparedness Program, and one of the programs besides the MRC is the Strategic National Stockpile. We commonly refer to it as the SNS. And basically it's if in case we ever get a chemical, biological, industrial outbreak, we have an opportunity to work with state and federal officials with the CDC to be able to bring in antivirals to protect our community. Your father, your mother, sister, brother.
Yeah.
We all got to work at, trying to make sure
This
that
is
our
in the
community-
case of some epidemic.
That's right.
You're going to want to stockpile whatever it is that would
Correct.
cure the epidemic, or at least slow it down anyway.
The antivirals and the materials that support that relief or intervention, for sure.
So do you have a degree in national stockpile,
Right, not
masters in
hoarding,
national stockpile?
preparedness, yeah.
Hoarding.
So, you know, I don't have a
Robert.
degree in that, but, you know, I need to improve on all of that, the stockpiling. But for the most part, I don't have a, you know, that certain degree. Well, my background's in nursing, and my master's is in public health and health education promotion at the university. And so,
At UH?
yes, and so we had a great opportunity to, you know, bring some real life skills into the capacity as the SNS coordinator, strategic national stockpile coordinator. I think you know, one of the keys is being able to work with the community, work with the team, and being able to implement plans that are tested and retested, and you know, just try to organize the best. Because again, we hope we never have to use, knock on wood, what we know and what we do in our capacity as strategic national stockpile. But if in case we do, you know, we know that the community will band together. We have a lot of great people and community agencies that'll step up and step in.
You know, on the nursing side, you know, I've had a little pain right there.
Yes.
And I wonder if during the break,
Right.
you could take a look at it. And we're going to take a short break
Oh
now.
my goodness.
Terry and I
Got to
have
put a
some business to do,
disclaimer here,
yeah.
you know, I'm not a prescribing doctor. Yeah,
I'm
but
sure
take
you
two
can
and
help.
call me in the morning seems to work, so, you know.
Take 2 aspirin. From the
Well, something,
stockpile
I don't
club in the
know.
morning. We are having fun. This is called Preparing for Public Health Emergency, and it's on Hawaii, or the state of health. Thank you, of course, to Miley Sakamoto, who helps us set this up from the Department of Health. And today we have Terry Visperas and Marjorie Tayao.
Tayao. Yes.
And we're going to be right back after this break. Okay, it's right.
Aloha, my name is Jim Sean, and I'm host of a show called Education Movers, Shakers, and Reformers. Each week, live streaming at noon on ThinkTech Hawaii, we interview people who have special insights into education, from early education through K-12, all the way through higher education and beyond. Both public and private are areas we're interested in. We dig deeper. We try to find out what it's really like to be involved in making change, advocating for it, how you reform, what people's philosophies are in reforming it. As I said, we're live streaming every Wednesday at noon on ThinkTech Hawaii. And later on, you can find these interviews on YouTube and on the Hawaii Educational Policy Center website. We hope you join us as many times as possible. Aloha.
Okay, here we go. We're back. We're live. We're here with Terry Visperas and Marjorie Tayao.
Very good.
See, it takes me 5 times, but I can do it.
Or did he take 2 and that's why he's feeling better? I don't know.
Yes.
Yeah, no, I am
Yeah,
feeling better.
yeah.
You know, he helped me during the break.
Amazing
I'm
what this
so
magic
glad we
water
took
can
that
do, right?
break. So you have to be a kind of epidemiologist, Terry, right?
No,
In order to do what you do.
Well, no, I claim nothing with that expertise, but we have great epidemiologists within the State Department of Health under Dr. Sarah Park, and they, you know, they work in tandem with me, and you know, whenever we have needs, there's a program for that, and for sure, you know, without their support, we wouldn't have been as successful as we strive to be.
I get the idea that this is largely a database thing. You have to keep control of everything you either have or will need in a given situation.
That is correct. I mean, you know, we really have to be organized. We do have, you know, if in case we have, say, anthrax, a breakout of anthrax, you know, we have to know how much we need. And again, the state is over 1 million people, so we've got to take into consideration the people that live and play here, work here, but also the big segment of working with our tourists and, you know, those that visit this great island and state. So yeah, we definitely have to work with our partners in the hotel and, you know, Department of Emergency Management, as well as the state HIEMA, to make sure that we incorporate everybody's input to make sure the success is.
And it's dynamic. I
Right,
mean,
it
you
is.
learn of some new threat or need,
Right,
and immediately you have to figure out whether you're going to stockpile this or not.
for sure.
And if you're not going to stockpile it, how can you get it from the mainland on an expedited basis
Right.
and all that?
And you know, there is a key to everything where if it's an actual emergency, declared emergency, you know, chain goes up, Dr. Park, Dr. Pressler, and then the governor, and then we will be able to then inform CDC. And they have a whole team set up. They've gone through this role play on an annual basis. We do communicate with that, and you know, we have plans in place that once they say go, in 12 hours, hopefully it'll be 12 hours for the Hawaii, you know, it'll be a little bit longer, but you know, the ideal situation is 12 hours. They'll push this pack out of antivirals, and we'll rely heavily on the community, but most importantly, our state employees, as well as our Department of Health, public health nurses and MRCs to be able to staff, we call pods, point of distribution. So we'll get organized, we'll make the appropriate communications to the community through radio, TV, and get the message out there that, hey, come. And I think the message that we really want to emphasize that all these medications, these antivirals, will be free to the public. So if you, you know, end up seeing somebody on the side corner trying to sell these drugs, just know that it's free. So don't go hoarding.
Right, don't deal with scalpers.
That's right, that's right. You'll pay over the price of free. So
okay, this is good. So, you know, let's talk about, a question. Do you don't stockpile a lot of stuff, so we should talk about like a case study.
Right.
Like something happens,
Okay.
There's a new virus in town. It's the L1NOP-ZRX virus, okay? And we know what it is because what? Because we probably either had a laboratory here or we sent it to a laboratory on the mainland,
Right.
and they identified it.
Yeah.
And then they come to you and they say, you know, what do we have in the stockpile that will deal with this?
Yeah.
And either A, you have, you know, your own,
Right.
our own stockpile of the antivirus
Right.
to deal with it, or you have to order it.
Right.
And it's all kind of on an emergency basis, I guess, if this
Right.
is an epidemic
Right.
of sorts.
Right.
What happens?
And we really never know what direction it's going to come in from, or what the
Yeah, we're an international
right,
report.
exactly,
Anything could happen.
exactly. And you know, I think it's good to note that we have one of the best state labs in the entire nation. They have just celebrated 20 years, I believe, of being in existence and doing great work up there. And they'll work furiously to identify whatever the organism is with Dr. Park, and making sure that everything is flowing. And again, we'll make the call to CDC. They'll be already in touch with us, and we'll cooperate and work hand in hand to make sure we identify and then activate, if need be, the strategic national stockpile.
Now, you would not be involved in quarantining anything or anybody.
Dr. Park, as well as the Department of Health, would probably be at some level. And we've, time and time again, have worked and have conversation ongoing with the Attorney General's office, Police Department, HPD. And so, you know, we think about the worst case scenarios and see what we can do. So when time comes, at least there'll be a smoother transition.
Right, because it is complicated. I mean, some people cooperate. We saw this in the measles thing a few months ago in California.
Correct.
Some people cooperate and some don't, and you have to bring in the Attorney General, essentially.
Right, right.
Okay, so now let's take the case of it's here.
Okay.
And you said you had a network to disseminate it.
Right.
You know, we're going to talk to Marjorie about whether her volunteers would be involved in that.
Oh, we will be.
Oh, okay. Well, that
Yeah.
was a fast answer.
Yeah.
Yes, we practice all the time.
Yeah, okay.
Right.
Yeah.
So when you need to disseminate something you have here,
Right.
what happens? You walk into this big room with a big bag, and you put it all in there, and then what?
Magically in my mind, that's how it's supposed to work. But, you know, we do a lot of planning with the public health nurses, as well as both the MRC and some of our other volunteers and security professionals. You know, we work closely with the U.S. Marshal's office, one of the police department, and basically...
Why do you need the U.S. Marshal or the police department?
They're there to protect the Eagle package, or the package that arrives from CDC, so that there's no interruptions for distribution.
Yeah, because it's mission critical,
Right,
and you can't afford to let anything
That's a
happen
good word.
to
It is mission critical, and then that's their focus.
Well, it's for
we
the
have U.S.
community,
We have U.S. Marshals that are just assigned to protect the strategic
Good.
national stockpile.
I'm feeling good about
Yeah,
that.
yeah, you
That's
should
a
be.
good move.
You
Feeling
should be have good
reassured.
guys there.
Nothing gets in the way. This is real serious.
That's right.
Yeah.
And you know, basically, if that happened, it got activated. CDC is ordering a certain amount of lots for us here in the state. That'll arrive by private carrier.
What's a lot?
A lot of medication, a lot
It's
of...
a unit of
Yeah,
medication.
it's a unit of medication.
Like a gaggle. of
That's correct.
medication, yeah.
And then, again, it'll depend on the numbers that were affected, or the population that was affected. And it would arrive, our U.S. Marshals would be there to meet the plane, making sure that everything was intact. And then they would take it and protect it to our warehouse. We would do what we have to do to redistribute that, and we would take it to our sites of distribution, in this case, points of distribution.
Yeah.
And that's where we would meet these incredible people from the MRCs as our partners in preparedness, as well as our public health nurses, who on an annual basis, we train with them. So,
So the point of distribution,
correct.
that's P-O,
POD. Yep.
is that fixed or does that change depending on, the intelligence you get from the field? For example, if I have this virus
Right.
and it happens to be limited to Kahala.
Correct. It's so funny you should say that. That's right. It's where the wind blows, right?
Yeah, well, sure.
Depending on the virus.
Okay, and
right?
all the cases
Right.
reported are coming from this neighborhood.
Right.
So I'm not going to go to Waianae
Correct.
to distribute. I'm going to go to where this is happening. So you have to make call it an epidemiology decision
Right.
about what's going on. It's vectors,
Right.
and geography.
Right.
Okay, so then Marjorie and her friends, her volunteers.
Oh, yes.
They take this in a truck, in a
Oh,
car.
no.
How
Well,
does this
they
work?
actually don't, but they will show up at the site of
Well, you're gonna
our
meet.
call.
We'll
You're gonna
meet him. We'll
Terry,
meet him.
you're gonna
Right,
meet
right.
him.
The bat signal will go out and I'll go meet him with my
See it now.
volunteers. You
It's
can see
that
it
Department of Health logo, and it shows up on the
and
sky.
my own logo. I have the MRC logo going into the sky.
We'll
That's
tell
what's
them, don't
gonna
make,
happen.
Yeah, that's right.
This is
And
good,
we'll
this
help
is good.
staff
Yeah.
the pod. So we'll
Okay.
help
So
distribute.
you're gonna meet
the
him.
medication.
Right.
Oh, yeah.
At maybe Kahala Mall.
Right, and
Or
so it'll be a
depending,
place of designation,
hypothetically.
for sure.
Okay.
And they get the call ahead of time, so once we know
So it's a
that this is a
rendezvous.
real incident, real life emergency, we will definitely be on the phone with Marjorie and the Department of Public Health nurses.
Yeah.
And they'll be there on an annual basis. Really, I'd like to talk about the MRC. These guys are incredible. They're either retired or active in their professions, but we have a lot of retired nurses. We have active doctors and nurses. We have just people that are passionate about supporting and helping
Yeah, that's
the
great.
community. And she's the leader of it all, and it makes it happen. And just really
With
blessed
a
to
lot of
be able to
help.
have.
Let's take a moment and talk about how you gather them up. First of all, how do you get them to sign up? Because
I
this
beat
is
the bushes with a stick.
exactly. You
That's
go
it.
out with
That's how-
advertisements. You
It's a word of mouth. University of Hawaii has a really good nursing program. So their instructors actually push some of their students to go into Medical Reserve Corps because we offer trainings, we offer a different outlook on public health. So there's that public health disaster preparedness or the disaster part of public health that people don't really know about. And so we do have exercises, activities, and training that students may not be aware of, and it helps pad that resume. It helps them.
sure.
It helps them in the future figure out what they want to do. If you're a nurse,
So
what
this is
area.
a regular nurse would sign up. I mean,
Regular
this
nurse
is like
would
a special extracurricular kind of community service
Yes.
thing she might want to do or he might want to do.
Very altruistic. I
Yeah,
have
it
the
is.
best volunteers. So very altruistic. They want to serve their community. They're in their community and they see a need, and they just figure out what's right for them. So Medical Reserve Corps, so public health initiatives, we do and disaster preparedness. So that's
Okay,
our
so
main
what's the
focus.
training like? Now by the way, how many are there in the reserve?
In the reserve, on Oahu, there are about 275 volunteers. Statewide, there's a little over 650. So
That's a lot.
statewide, yes.
That's a lot.
So I do have that, like that reserve
And you're
cache.
supervising all of them?
Not really supervised. I have my MRC unit coordinators on each
On other
island,
island,
and then we
okay.
just get together and we talk about stuff.
Okay, and the training, do you do the training island by island or one
Island
big
by
train?
island.
Oh, cool.
Yeah, so each island has their own training. Each island is different. So Big Island, they bear the brunt of a lot of the disasters. So they may have different trainings. We all have uniform trainings that we have, basic orientation, CPR.
Are you a trainer person?
No, I set up the trainings.
Okay,
So I
okay.
have other people work for me.
Who are your trainers?
Oh, that's a good question. So, for instance, we have basic disaster life support. Pacific Imprints from University of Hawaii, they provide that training. AED Institute. They provide
So you bring in
I bring in
experts.
experts.
Cool.
Yeah, so I contract out, I
And
get them.
you set up the curriculum about exactly
Kind of
what
like
they're
a
going to be trained
curriculum,
in.
yeah. So we're getting better about that. Our medical track, if you're in a medical track, if you're a nurse, a doctor, and you want to get something different, we have advanced disaster life support training that we put on every year or every other year. So that's something interesting, and that's an intense course about
So like
decontamination. and-
CPR and that kind of thing.
Oh, like way more intense than that.
You know what other things that Marjorie also offers is great opportunities for these MRC volunteers to get really active with preparation. And they do, on an annual basis, the Stop Fluid School support, and they also, during the marathon, they're a big part of that marathon. They provide medical support at these stations.
And it's a
just
way they keep their
all the
skills
extra-
fresh, yeah.
And it's just all extra, and these guys are heroes to all of us, and they're really, really dedicated. And a lot of them, again, the nurses that are employed by the major hospitals, that's their first call, obviously. But for those others that are retired or working in the community health setting, those are the people that we really appreciate. They go above and beyond to join the MRC.
This reminds me of the police reserve. There's
Right,
a police reserve, and it's policemen, but it's also retired policemen. It's anybody who has community service on the mind. What makes me wonder, how long has the Reserve Corps existed? Does this go back way, way back into Hawaii? I know the Department of Health is a really, historic organization,
old.
in the 19th century and all that. And it's really it's a feather in our community cap. But I'm wondering about the reserve. When was that established,
So the MRC came about for Hawaii's Medical Reserve Corps. They were established in 2004, but the MRC nationally is a national organization, and it happened after September 11th. So after September 11th, there were a lot of volunteers that happened on the site. They wanted to help. You have people who just really want to help. But some of them were turned away because they weren't affiliated with an organization. You couldn't prove who they are. Some were saying we're doctors, we're nurses, but how do you vet them? How do you credential them?
Yes.
And that's how the Medical Reserve Corps came about. So having that centralized database of who is this person, their background check, their credential, their license is up to date, where do they come from, all of that is essential in order to keep your volunteers safe as well as the public safe. So that's where it came about.
Yeah. That's a really good decision. Was that a federal government decision or
Yes.
a grassrootsy decision?
It was a federal government decision. They saw a need to organize, and it came about, and it just took on a life of its own. So after September 11th, a lot of preparedness, we have to be prepared for other attacks. And it just really morphed into public health and everything, so wellness and being healthy. And
That's great.
Yeah,
That's great.
you have all these volunteers.
9/11 is a perfect backdrop for it. I remember how, I was here, as we all were, but I remember how people came from all over the country to volunteer, and the authorities in New York City didn't know what to do with them because they didn't know who was who. And people were coming out of a kind of, a community, wish to serve the community, but they had no skills. And so what do you do with them? And this is a great solution for that problem, So back to our case study, okay? Okay, so here we are in Kahala Mall. Sorry, Kahala Mall. So you're there,
Right.
you have the antiviral vaccine or whatever you call that. Okay, and Marjorie meets you with her volunteers, and there are nurses among them, or?
There's everyone. So there's nurses among them, retired doctors,
Everybody's there
students,
because-
everyone's there.
Everybody in the reserve,
Right.
including
Yes.
nurses and doctors?
Yes.
Okay, and the idea is we're gonna inoculate, is that the right word, vaccinate?
Well, it depends on the.
Let's assume this
yeah,
is an
right.
inoculation or vaccination.
Right.
thing. So now, you're gonna go out into you've already publicized this, right?
Right.
It's been on the radio, TV, everywhere you could go,
Right.
and I'm sure that if you said this to the media, they would report it immediately.
right.
And so now people presumably know what you're doing. So how do you reach the population you need to reach?
So I think, just to make clarification, again, those, if you say that we're going to give injections, you know, we got to make sure that those people that are giving injections, even MRC,
Yep.
will have to be licensed as a
Embedded.
practitioner, as a nurse or a
Yeah,
doctor
sure.
to be able to give those injections.
That's
The
why
other
you need to
people-
have them in the
That's
reserves.
right, that's
Yeah.
right. And those that are not, there's roles for them in the setup of a pod. And, you know, I'm not saying we will never use Kahalamal, but more along the lines of planning, we would lean toward maybe a Department of Education or city
state
and county
government facility,
facility
yeah.
that, you know, we've practiced with
Good
or have
point.
plans, pre-plans for. And, you know, I mentioned a little bit about, we do annual training drills with both the MRC and our public health nurses. And, you know, when the time comes, we will then, from our warehouse, bring that antiviral or those injections to the location, be it be one of those state facilities or city county facilities. And then our team would have the entire setup from screening, passing out forms, and basically dispensing. And, you know, we want to get medications to people. And
But
that's
when you say
basically-
our team, you mean the
Yeah.
Reserve Corps?
We're
or
talking
you
about the
mean
Medical Reserve Corps
the
plus
stockpile
the
team?
public health.
Yeah.
We are together, I think, in an emergency of that case and that nature. We definitely couldn't do it without those. You know, my role with a lot of the team members is basically to get the coordination and communication with CDC and our state government, but to get the medications there to the site. And again, with the public health nurses' help and our MRCs, together we will distribute that and just as fast as we possibly can to make sure, you know, people in the masses get their antivirals.
How do you keep order on something like this?
I think we definitely have to go through the different case scenarios, but really we want to stress it's free. We want to make sure that we have an even line of flow. You know,
So,
there's
for
different
example-
stations.
For example, you have X units
Right,
of, what did you call that?
Right.
Of the lot.
right,
Mm-hmm.
right.
But there are 3X people out
Mhm,
there.
mhm, mhm.
How do you handle a situation like that? What do you say to them?
Right. We will have medications for everybody, and so much so that we could designate the head of household to pick up for their particular household. You know, we've teamed up. We are currently working with some great agencies and companies throughout the state of Hawaii to do closed pods, and you know, they will then in turn work with their employees to get them to work. They would be able to get these antivirals and then do their daily operations and then take that home to their family. So there's different ways that we're working with the community to prevent any type of chaotic situations.
Yeah.
You know, so
And the reserves are probably trained in that too. The idea is to,
Yep, it's with messaging. So with
Yeah,
the
messaging,
volunteers
yeah.
who are in the reserve, they have a understanding when they do the orientation. They understand what we're there for. We're surge capacity. We help with these types of activities. Stop flu at school when we help out with the staffing. It's technically a mass vaccination clinic. So you have the kids that go and get their flu shots, and that's what the flow would look like. So you have the consent forms or the forms going, and they get walked to the line, and you know, you get checked and you get your vaccination. There you go, and you're off. So we practice every year.
yeah. Have you ever had a statewide emergency, or, I mean, an emergency which required you to galvanize forces like this?
I think, you know, with H1N1, I wasn't in this
Oh,
capacity.
that's right,
But they
yeah.
did
Early
have a
2000s,
process
yeah.
that they had to work through, and we took a lot of best practices from that opportunity, and we've grown from there for sure. You know, and you know, with all these public health diseases that are out there, you never know when, yeah? So
That's
we just
true,
always just
and
gotta
it's
just
still a
be
risk.
steadfast and
Yeah.
try to prepare and train as much as we can to
Yeah.
anticipate.
So how, you know, now we've been talking about a case study with one neighborhood.
Right.
With vectors in only a limited neighborhood.
Mm-hmm.
Suppose it's, you don't know
Right.
if it's limited. I mean, it could, you know, the H1N1, was that an H1N
Right.
or something?
H1N.
Thank you. I mean, there were all kinds of other considerations, and I remember going to a program at the medical school where they were wearing these
Oh, no.
total space outfits, you know.
Right.
And they were protecting themselves from every microbe, you know, is really interesting. You know, that's a different situation, isn't it? You're everywhere all at the same time.
Right.
Do you have a plan for that? I mean, how do you handle that?
Right.
It's very challenging, isn't
Right.
it?
I think on a daily basis, we try to think about those situations and
Mm-hmm.
we try to prepare as best we can. But again, you know, the time of disaster, we just want to make sure that we clearly communicate what the plan is. And we continue to be in constant contact with all of the different agencies that make up the Department of Health, state agencies, city and county. And I think together we're better, better, more prepared since H1N1, better, more prepared with our annual drills that we do and practicing. Our Stop Fluid School is another example of an opportunity for us to be on the same page and, to just work on those best practices. Never say never, but we're working in that right
No,
direction.
I mean, it's comforting to
We've
know
got
that
some
you're
great
thinking
people.
about it,
Yeah.
working on it, preparing contingency
Right.
plans. It's readiness is what
Right,
it is.
right, right.
And in that same vein, I have this, this.
I thought we took
take
care
a
of that during the break.
Came back. We're gonna take another break with Terry Visperas.
Yes, that's great, thanks.
And Marjorie Tayao.
Tayao. You almost had it. Thought you had it.
Chinese? No,
No, it's Filipino.
Filipino.
Yeah.
Tayao, okay?
There you go.
And Terry is Public Health Preparedness Coordinator of the Strategic National Stockpile, and Marjorie Tayao
Very
is the
good.
Medical Reserve Corps Coordinator, both at the Department of Health. And today on Hawaii, the State of Health, we're talking about preparing for a public health emergency. We'll be right back, and after we come back, we're going to talk about what the public can do to help these guys in their efforts to stay ready. We'll be right back.
Aloha, my name is Josh Green. I'm a senator from the Big Island. I work in the ER there. But on Tuesday afternoons, I get to come and spend 45 minutes to an hour with Jay Fidell and the ThinkTech staff. They're terrific professionals. They help us to bring some of the leading cutting-edge topics here across our state to you. So you can join us at our show on healthcare in Hawaii to talk with leaders from across all the spectrum of health in our state, or you can join us for any other show where we talk about economic development or tourism or some really eclectic programs too. So really, we love to see you here on our show. Thanks for joining us and thanks for supporting us.
Hi, I'm Chris Leatham, and I'd like to invite you to come and watch my show every Wednesday at 3. I'm interested in a variety of issues that have to do with politics and our local business economy. And I'd like to bring on guests who like to talk about everything from technology to social media to what we can be doing to improve our environment. And so I'd like to invite you every Wednesday at 3 to stay and watch my show here with ThinkTech Hawaii.
One.
And I'll see you
Bingo.
there.
We're back.
I wasn't sure there. You said if.
Well, we made it.
We made it.
Terry Visperas and Marjorie Tayao.
Very
There
good.
you go.
Okay, and so, I want to talk about the storm here that's coming or not coming.
Right.
As the case may be tomorrow or
Right,
not tomorrow, as the
right.
case may be. So does this storm interest you? Could you get involved in a storm like that? Or is it not really your focus to be worried about storms?
I think it's all of our responsibility to be
We're always worried.
engaged, be informed. And the Department of Health has already sent out reminders, or at least, on a monthly, we have a drill that, we have text or phone calls that says, this is your monthly test. And so they've already done that. Right before we came here, they had, this automatic phone that says, please be prepared, get your Go kits. And speaking of Go kits,
Oh, yes.
Yeah.
So the Department
Okay,
of
so
Health.
Marjorie's kept this
yeah.
in her lap the whole
The
show,
whole
waiting to
show.
reveal it to you.
So
Okay, the
we-
question is,
okay.
what should the public do? And this is the answer.
The public should be getting their emergency kits ready. So just very basic things, water, food. If you have a radio, make sure your batteries are charged up. Medications, clothing. That's optional, I guess, that you wanted to say.
please bring clothing.
Yeah, please have clothing. Flashlight, hygiene items, first aid, and cash. So that was in the event that all the electricity is not working.
Yeah,
cash.
credit cards don't work without electricity.
Credit cards won't be working. So cash. If you have infants or pets, don't forget about them as well. So infants, the formula, and the water part. You've seen people stockpile
What
water.
about filling my bathtub?
Right,
Is that important?
Right, and they have that great thing,
Not yet.
you can find it on Amazon or at Red Cross. They sell this bob, I think it's called the bob, and you can put this little mattress inside your
Oh.
bathtub, and it keeps it from the barrier, and you just turn on your faucet
Oh.
if you have an impending disaster or you need water.
There's
And it's
things.
good water,
Great.
right? Yeah.
Great,
Yeah.
great,
Things
great,
you can
yeah.
do. So everyone should be checking their emergency kits, getting gas, things like that before the storm hits.
Yeah.
So
How long before the storm hits? I
right
mean, if
now, you
it's-
can do it right
Right now would be a good day.
Yes,
Well, you
right
know,
now
yeah.
would be good.
Yeah, I gotta go now.
But
Okay,
you know,
we're done.
I wanted to point out that we have, again, that Plan 9, and really, if you or your group or organization, you want more information, for sure, give us a call at the Department of Health. We'd be more than happy to
Right.
send that, or
Very good.
have you pick that up from the
Okay.
Department of Health. It'll be a great, reference material. And again, really, you can never prepare enough for a disaster or emergency. This one, again, we're staying in touch with our department, Department of Education, Department of Health, and all of the different departments all have a opportunity to liaison with the Department of Emergency Management, city and county. So
Is that Carl Kim? Because
No.
Carl Kim is coming at the next hour. As you leave the studio
That's right,
here
he'll
in
be there.
Pioneer, he'll be coming
We'll
in,
bump
I
into
hope.
him.
And he's going to talk about preparedness.
Good,
you know,
good,
same
good.
thing.
We're all
So you
tag
have a
teaming on the same
liaison
efforts.
with him in his office?
Not so much with him, but with the city and county Department of Emergency Management, with Mel Kaku and the mayor.
Okay.
So we all share this opportunity to work together if in case a storm or emergency happens. And hopefully the goal is to be all on the same page. And if they need resources, we'll do what we have to do.
Is
to
it
make
real
sure.
time? I mean, do you talk to them real time
Yeah.
while
Right.
things are
It's a
happening?
No, it's
coordinated
right.
effort.
Yes.
Yeah.
Right.
So, Marjorie, where do you get this? It's the
All my
Department of Health, but
information-
where?
My information is, should come up later on, but you can email me. We also offer presentations, so disaster preparedness presentations for your organization. So we go to your church group or your, depending what kind of group you have, but we'll do a disaster preparedness presentation for you, and we can give the materials.
So
as
when the
well.
winds are kicking up to 60, 70,
Not
80
now.
miles an hour, I'll give you a call and go down.
You're on your own. No, I'm
Just
not
so
gonna
long as
come.
you come with us, Jay, all
Yeah,
right?
you
If
can-
you come,
I
we'll
will
possibly
inoculate
try to
you
make
to
it out
be
there.
part of MRC,
Yeah.
and you can do the presentations as well. So before anything happens, when the skies are still sunny, then we can do a presentation
That's
for
a
your
better
group.
time.
Right,
That's
right, right.
it's always a better time.
Okay, there it is on the screen.
There it is.
Marjorie Tayao.
Yeah. Yes.
Right.
Very good.
So they're always looking for great volunteers.
Yes, and
you
if you want to volunteer for
great.
MRC,
Yeah, okay, now, do I have to have any credentials or experience?
Nope. We take
to
everyone.
volunteer? Yeah.
we take
And
everyone.
you'll take care of me. I mean, you'll train me. And I'll probably have the advantage of being with you guys.
That's right. We would look forward to it. You committed
During-
already.
during the
We expect the
calamity.
call, Jay.
You'll get everything first. No, I'm kidding.
Well, okay, I mean,
Be privy.
I think it's very important that you guys are doing this. I'm the kind of half empty guy, and I walk out the house on a beautiful, beautiful day, and I say, just me now, I say, one day closer to a really bad storm. And we
It
haven't
should be
had one in a
emergency
while.
management.
Let's knock on wood again,
exactly.
Right.
We haven't had one in a while, knock
Yeah,
wood,
yeah,
but if you
I
look
think
at
we're
the
due
rule of
for it.
probabilities,
Yeah.
you know that
Right,
it's out there
right,
somewhere, yeah.
right.
And with climate change,
Right.
Or hot topic.
I keep thinking of, what was the name of the one in New Orleans?
Katrina.
Katrina,
Right,
and the
right.
people in the bowl there, and how they were, isolated, and they didn't have any resources at all. And that could happen here in the
Right.
same
Oh,
way.
for sure.
You
It
know,
could.
everybody focused in a public place, but you guys would be there helping,
Right.
and
We
make
would
sure
be.
that there's no public health issues there.
Yeah.
But it's
we-
important, though, that, again, the Plan 9, make sure that you're prepared. It might be,
We need
it may
everyone's
sound
help.
silly to prepare, but really you could put it in one of those clear boxes, or you can just put it in a pillowcase, just some of those things that we talked about, the Plan 9. And, really you go in knowing that ahead of time, if you have to go and evacuate into a shelter, there's really nothing there for you except great people that are passionate about helping. But really, you have to do your part as a community
That's
to
a
bring
very
in,
interesting point.
don't depend on anybody else.
So this Plan 9 is really focused on being home.
Right,
Yeah.
This is.
as best as you can.
Weather
for
the
whatever
storm
hours,
at
yeah.
home.
That's right.
And I think the point you made, I think is really an important point to remember, is if you have to evacuate, you really need this
Right.
list of things
Right.
to take with you, because you don't know if any of them are going to be available
Right.
at the place you are
That's right, that's
evacuating
right.
to.
That's right. And if you live, like we have so many great high rises that are coming up in Kaka'ako, get to know your neighbors. I mean, that's the key. because they may be your first line of,
Yeah.
first responders.
I can't afford
No.
one of those, so I wouldn't
you
know my
deserved
neighbors there.
So, depend on them because we have some great emergency preparedness officials. We've got the Honolulu Police Department, EMT, but they're going to be busy. And so really, if you can take the proactive steps to take care of yourself and your family and your neighbors, I think that goes a long way. And, we'll do our best every day to try to make sure
Terry,
that.
are you career? Are you gonna, I mean, I'm feeling good that you're there, but I
No,
wanna know
thanks.
how long you're gonna
Well,
be there.
I work with great people and I'm there, I'm committed. So thank you for asking.
Marjorie?
Oh, yes, I'll be there.
Okay. You're the ultimate volunteer,
I am, oh, am I?
except you're actually employed.
I can't do it without them, so,
Yeah, okay.
yeah.
All right, I'm gonna give you guys a minute each now to leave your message, okay, with the public. Anything you want them to remember from this discussion, okay? It can be serious, or maybe it could
Not
be
so serious.
not so serious. So who wants to go first?
Go.
Marjorie,
Oh,
ladies
okay.
first,
That's
okay.
right.
So I'm.
Look at that
okay,
camera, tell them in their hearts, look at that camera.
If you want to volunteer with the Medical Reserve Corps, my information was on there. You can Google me as well, but we have a Facebook page. It's Oahu MRC. Just Google that, and you can sign up from there. You can direct message me. But I just wanted to thank all of the volunteers because without them, all these activities, all these exercises would go empty because they actually come out and they help. They do what they're asked and they never complain. So thank you to my volunteers. And if you want to volunteer with me, I'd be very grateful.
Wow, that's Marjorie Tayao. And furthermore, now everybody's walking around in the street pronouncing her name correctly. This is,
Said it like 18 times.
we had a positive effect in that regard. Okay. Terry, what's your message that you would leave with the public?
Oh, thank you for having us. I appreciate it, Jay. It's been a great opportunity to share the message of preparedness, both with the Department of Health. And, I'm only one individual, Margie's only one individual, but together as our team back at the office and with Dr. Pressler and Dr. Park, I mean, we really are passionate about what we do, and we know that, together we are better. And just know that when the time comes, if we ever have to use the Strategic National Stockpile, we have plans in place, and we're currently, working on bettering the system, being able to communicate effectively. And again, it all begins with you, though, to make sure that you're prepared. And just remember, again, when we have the Strategic National Stockpile, the medications will be abundant, it'll be free. And the main thing is that we'll do our best to communicate to you, the public, to make sure that you know where and when to get these things. And, we don't want any chaos, we don't want any chaotic situations. We'll do our best to prepare. And again, thank you for your time. Look forward to continuing to serve the Department of Health.
Thank you. Thank you, Terry Visperas, Public Health Preparedness Coordinator, Strategic National Stockpile, and Marjorie Tayao, Medical Reserve Corps Coordinator. You guys have been great. This has been fun and
Thank you.
educational.
Thank you,
Thanks
Jay.
for coming on the show.
Appreciate it. Thanks.
Aloha.
Thank you.
There it is.